Welcome to the Healing Sexual Trauma Summit. I'm Marcy Little, your host, and with me today is Dr. Betty Martin. Dr. Betty Martin, welcome.
Thank you. Thank you. It's good to be here.
Wonderful to have you. In every interview, we begin just by taking a moment to get centered, get present. So feel free to be comfortable. And if closing your eyes feels good, go for it. If you'd like to just lower the eyelids or look straight ahead, whatever works for you. Personally, I just feels good to let out a little bit of sound with the exhale and start to notice the sensation of my body, making contact with what I'm sitting on, feet on the floor. And then I just tune into my breath and invite you to do the same and just notice what's there. No need to change a thing, just notice yourself right in this moment as you are. Good. And feel free to open your eyes when you're ready. Oh, see, a yawn comes in. That's good. Sign of relaxing right into the body space. Love it. As you know, because you do this work. And I want to invite viewers at any point, if you notice yourself feeling overwhelmed or your body starts to tighten up or your breath gets shallow or you just feel like, I've got to get out of here, hit pause, give yourself a break. Walk around the room, shake it out, pet your animal, do whatever you need to do and come back if it feels right. Okay, so that said, Betty, I want to tell the viewers a little bit more about you. How's that sound?
Okay, great.
Great, here we go. Dr. Betty Martin has had her hands on people professionally for over 40 years, first as a chiropractor, and upon retiring from that practice as a certified surrogate partner, sacred intimate, and somatic sex educator. Her explorations in somatic-based therapy and practices informed her creation of the framework, The Wheel of Consent. As part of her work with the School of Consent, Betty travels around the world teaching practitioners how to create empowered agreements in their client sessions. In her highly sought after training, Like a Pro, The Wheel of Consent for Practitioners. Originally developed as an offering to teach much needed consent skills to sex workers and touch providers, this training is now attended by somatic therapists, massage therapists, sexuality educators, medical and health care workers, activists, human resources folks, and the spectrum of touch-based professional providers, all of whom complete the training with a clear understanding of how consent starts with our own bodies and then expands outwards in all forms of human relating with or without touch. I love that. And there's a little more here. The art of receiving and giving, the Wheel of Consent, is based on the work of Betty Martin over her 30 plus years. Oh, this is a repeat. Oh no, it's more. This is about your book. This is about your book. Okay, so The Art of Receiving and Giving, the Wheel of Consent is Betty's book. And it's based on the work, your work, and your 30 plus years of working hands-on with patients, clients, and students. And over the last couple years, Betty, you've been graciously assisted by Robin Dalton, hope I said that right, who helped you get your book over the finish line. It's not always easy to get a book over the finish line.
No, it's not.
Yeah, especially one that's 30 plus years in the making.
Yeah, I actively worked on it for about 13 years. And it took a couple of years off here and there. So, it's probably about a 2-year process spread over 13 years.
Yeah, I know a little about that process because I'm just releasing my own book too. So Betty, with that introduction about you, is there anything more you'd like us to know?
Yeah, I'd like you to know that those descriptions of my work also should include sex worker. That in this large umbrella of working with people hands-on with their own eroticism and their own arousal, that means I'm a sex worker, and I like to acknowledge that, because I think it's important to acknowledge that this field of work, the wheel of consent, arose from my experience with lots and lots of people and their bodies.
Yeah.
And my body.
And your body. Yeah. And being a sex worker is one form, I guess.
Yes.
Um,
Yeah.
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 Got it. Cool. Well, thanks for bringing that up. And I'm not even certain everybody knows what you mean by sex worker. Do you want to define that?
Sure. Well, sex worker means if you work in some way with human sexual arousal. So it may be an escort, or which is a common euphemism for prostitute, or a stripper, or exotic dancer, or a phone sex operator, or a porn star, or producer, or it's a very wide range. And yeah, it's
So
very widely defined on purpose.
Right. I want to come back to this in a few
Mhm.
minutes because I have more questions.
Okay.
But I also wanted to ask the same question that I ask everyone who I interview, which is what made you want to be part of this summit? This is the Healing Sexual Trauma Summit. So yeah, what about that made you want to be here?
Wow. Because I think it applies to all of us to some degree or other.
I'm so glad you said that, actually. Because I think that's like the big secret in a way.
Yeah. Yeah. And you can think, well, trauma, that just means the big crack, things. And no, that's not true at all. There's many, many things that can be or are traumatic or experienced as traumatic that includes pretty much all of us.
Yeah. Okay. All right. Well, thanks for answering that. All right. So how did you go from being a chiropractor to becoming a certified surrogate partner, for example? Is that an okay word to use for what we were talking about before?
Yeah. Surrogate partner is one particular way to practice. And a surrogate partner means that there's the client, and there's the sex therapist, and then there's a person who does the hands-on, and that would be the surrogate partner. So it doesn't always mean sex as in sexual intercourse, but it can mean, going out on practice dates, helping someone learn how to groom themselves, or practice touching or hugging or kissing, or it's basically, sex therapists are not going to engage in that way with their clients. And if their clients don't have a partner to practice the exercises with, they need somebody to practice with. So surrogates were invented in I guess the 60s to work with sex therapy clients. So it's a triadic model. It's three. It's you, your client, and their therapist. So you're all three talking to each other all the time. So it's kind of a medically sanctioned
Model.
approach. Yeah.
Yeah. So I'm going to be candid for a moment and just share with viewers, and I got my son's permission to do this. He consented. I have a son who has Duchenne's muscular dystrophy, which is a progressive muscle wasting illness, and he's been in a wheelchair since he was 12. And a few years back, he was very proactive and knew that he wanted to be in a relationship, but he has a body that's very fragile. And kind of, from living in a wheelchair, it kind of is, it has some pretty special needs.
Yeah.
And so he did the research and he found himself a sexual surrogate to work with, so that he could understand, well, how does it work with my body?
That's a really, yeah.
And now he's in a committed, long-term living together relationship with a beautiful young woman. He's 24, she's 26, and they have a blog and they write about it. It's like,
oh, great.
I know, it was a huge success.
Yeah.
And he needed that. And it was
Yeah.
hard to find. And it was very expensive.
Yeah.
Yeah. Yeah.
Yeah, that's a beautiful story.
Yeah. So what got you into it yourself?
Well, in my mid 40s, after divorce, I realized that there's got to be more to sex than I thought there was. And I was reasonably functional sexually. I could have a good time, but I knew that like there's got to be more here. Something else is going on here. So I took a workshop with the Body Electric School. Um, they're still around. They're going great. And it just blew the lid off my little white picket fence, straight sexuality. And then I took another one and another one, and then I met with a few friends who had also taken those workshops, and we met every month for 2 or 3 years, just experimenting and exploring. And it wasn't about sex as in, sticking something in somewhere. It was about what is the nature of eros? What's it mean? How does my body work? What happens for me emotionally when I get turned on? What happens to my body? What happens to this sense of connection? And so it was all experimental. We used massage, we used dance and movement and breath work and all kinds of things, just experimenting. And it was my spiritual path for a while. It was like, okay, what is the nature of me and eros and the world? And you know and it was a very rich few years. And coming out of that, I realized, I want to be able to offer this to other people, some of these experiences. And so I closed my chiropractic office, which was in a small town. I moved to the city, which was in Seattle. And I hung out a different shingle, calling myself a sacred intimate, which was a term coined by someone else. And this was in the days before websites. So I, made a little brochure, took it around to various places. And I knew, because I'd been a chiropractor, I knew how to take a history. I was sort of clinical, it was really more coaching than anything else. And and I would, get people on the massage table or, guide them in other ways into their own arousal. And at one point, I realized, well, with the people for whom I am comfortable doing this, and for whom it's a good fit, I want to be able to be more explicitly sexual with people. I wanted to get sexier, and so I created a new persona, um, put up a new website with a different fee structure, because if I'm going to get naked, it's going to cost you more than if I don't get naked, essentially.
Mhm.
And so then I had two practices. I had Betty Martin as coaching, and I was always clothed, and we would go pretty slowly and carefully, and we would focus on skills. And then I had another practice as Beth Morgan, which was the same thing except sexier and
And more naked.
more naked. Yeah. And so, and even as Beth, what interests me most is seeing people's aha moments, their wake up moments. They're like, oh my gosh, I never thought of this, or oh my gosh, I didn't know I could feel this way, or oh my gosh, it's okay for me to want this. And so I feel really honored to have been privy to so many people's erotic lives, their erotic inner lives as well as their outer lives. And as you can imagine, I learned a lot about people and what it means to be human. And I'd already been teaching peer counseling for 30 or 40 years, so I was familiar with kind of how people work. And so this was adding another layer onto that, which I just loved. I just loved that work. I've pretty much retired from it now, but I feel very, very lucky to be privy to so many people's intimate experiences, and some of them, um, you know, sex workers, prostitutes will tell you this. People tell us secrets that they don't tell anyone else. They don't tell their therapist if they have a therapist. They don't tell their wives. They don't tell their boyfriends. They, you know, and because it's obviously a potentially very intimate setting.
Yeah.
Doesn't have to be, but it can be.
Right. That intimacy leads to
Yeah.
a deeper kind of
Yeah.
open sharing.
Yeah. Yeah.
Makes total sense.
Yeah.
Yeah. For sure.
And a lot of that, I think, is because of the shame that is put, that society puts on us around our sexuality, that you can't just tell your partner that you want to do X, Y, Z, you know, because it's shameful and that's, you know, good. So you tell your sex worker, and then because they can handle it. We've seen it all. Like what you have does not scare me. Yeah.
Very liberating.
Yeah. Yeah.
Just really liberating. Right. Because, as you say that, I'm imagining, we do our own work on ourselves, with ourselves. We work with our own shame, and we do our own liberation, and yet we're still with another person.
Mm-hmm.
And they have their whole host of.
Yes. Yes.
Yeah.
Yeah.
And
Yeah.
that's, and we're working within that kind of.
Yeah. Yeah.
I don't know.
And our trauma, to the degree that we have sexual trauma, it didn't happen when we were alone. It happened at the hands of another person. So, of course, being with another person is going to be challenging. Of course it is.
Right.
Yeah.
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 I can feel, just sitting with you and hearing you talk and feeling you say those words, the deep compassion and that comes with, your presence with people in their bodies, and
Oh, thank you.
yeah, and how deeply healing and opening that is, even just of itself. Like some
Yeah.
kind of a deep acceptance that I feel in
Yeah.
you, Betty.
Yeah. Yeah. Thank you.
Yeah.
Thank you.
Yeah.
Yeah, I think we practitioners have to admit our own wounding and our own fucked up shit that we do and believe, and because ain't none of us above it. Yeah.
Right. Awesome. Um, that brings me to the wheel of consent.
Okay.
Yeah, and I'm really curious. So what exactly is the wheel of consent?
The wheel of consent is a practice and a model. It's a practice of taking turns. So, and it grew out of touch. So we'll use touch as an example. But for example, if I'm touching you, I may be, for example, running my hand down your back. Am I doing that for you, the way you want it? Or am I doing it for me, the way I want it? And there's quite a difference. And the difference is really important. And the difference is delicious. Because we need occasions for both of those. And it's really helpful to be able to tell the difference. And so as a practice, it's based on the 3-minute game, which is two people ask each other these two questions. And the two questions are, how do you want me to touch you for 3 minutes? Oh, well, would you such and such? Yeah, and then you negotiate and then you do it. And the second question is, how do you want to touch me for 3 minutes? And that one, people very often get confused for lots of reasons, which we can come back to. But then, oh, well, can I play with your hair? Can I, feel your legs, whatever? Yeah, you can do that, but not this. And so then you negotiate out and then you do it. So by the time both of you ask both questions, it creates 4 rounds. And what you notice is that each round is a different combination of who is doing and who it's for. So I ask you, how do you want me to touch you? And you say, will you scratch my head? Okay, so I'm scratching your head. So I'm doing what you want.
Mhm.
And then you would ask me the same. We do that. So then you would ask me, how do you want to touch me? I'd say, well, can I play with your ears? Oh, yeah, okay. So I'm playing with the ears. Now I'm doing to you, but it's the way I want.
Mhm.
So you end up with these four: I do what I want, or I do what you want,
Mhm.
or you do what I want, or you do what you want.
Yeah, I really see what you're getting at here,
Mhm.
and how unconscious often our touch is.
Oh, yes, totally.
Yeah, yeah.
Yeah,
Like you said it.
yeah,
It's like who
yeah,
am I touching you for you, or am I touching you for me?
yeah,
So this wheel of consent, yes, um, which is a practice, really
yeah.
makes conscious.
Hmm. Hmm.
And I'm guessing that spills over then even
Hmm.
beyond
Into everything else.
practice. Yeah.
Yeah, yeah.
So let's say, for example, now how do you want to touch me? And you say, I'd like to touch your earlobes. And what if I don't want that?
Then you say no,
I don't want.
or
Try
you
again.
can explore them, but don't squeeze them, or you can, whatever limit you want to put on it.
I see. So there's
Yeah.
consent built in
Hmm.
to how you're going to touch and be touched
Yes.
every time.
Yeah. Yeah. And of course, you can change your mind. You may be playing around with my ear, and I decide to suddenly, it's too much. Stop.
Uh-huh,
Totally fine. Of course.
uh-huh.
But, when people first learn the game, they forget that it's possible to choose, or forget that it's possible to change your mind. So, the importance of being able to change your mind in the middle of something, or the importance of being able to choose what happens to you, what you do. I didn't make those up. Like, a lot of people are teaching those, and it's really important. What the wheel of consent does is differentiates this question of who it's for. And just in the playing of it, these other things come up. So you have an opportunity to notice that, oh, wait a minute, this is for me. You mean there's something that I want to do? I never thought of that.
Mhm.
And it may be confusing, like, well, I don't know what I want to do. Then just wait a while and then you will. You're like, as if not knowing is the problem. It's not a problem. Not a problem at all. Lots of times we don't know what we want. It's only a problem if you're in a hurry to get going. But if you're not in a hurry to get going, it's not a problem. You just wait a while and it will bubble up, and then you'll know. And, it might take a while. Feels like forever, but it's just a few minutes, you know? Um, so, so in playing the 3-minute game and playing the wheel of consent, all these different things come up, like the importance of noticing, taking the time to notice what you want, and trusting that, and valuing it, and communicating it, and the importance of noticing that you have a choice to say yes or no, if you're okay with this or not, and that you can set a limit and say, yes, you can play with my leg only up to my thigh, or yes, you can play with my right leg but not my left leg, or yes, you can play only up to my knee, or don't squeeze. You can set those limits to what you're willing to do. But people forget that. And it's
Or
natural.
or
Forget
they
it. Or
never
they
learn.
never learned. Yeah. Or
Yeah,
they never learned.
right.
Um, and yeah, because we're all touched against our will when we're babies and small children. You can't grow up without having things done to you that you didn't want. And in the best of circumstances, it was done with respect and kindness. You had your teeth brushed, you had your diapers changed, you got picked up out of oncoming traffic. I mean, we're going to have things done to us. So in the best of circumstances, it's done with kindness. And in the worst of circumstances, it's truly awful. Most of us are somewhere in between there. But so you learn that, well, this stuff is going to happen to me, and I guess I have to kind of be okay with it, or I have to fight it off, or I have to like it, or I have to shut up about it, and it's going to happen whether I like it or not. So your body learns that that's the nature of touch. The nature of touch is that stuff happens and I don't have any choice about it. Well, sometimes that happens, absolutely, no question about it. And when you learn that you do in fact have a choice about it, holy fuck, like that is life-changing. Like, you mean I can tell you how to touch me? Oh my God. I mean, are you, and it's, what was amazing to me as I started playing with this with clients was that a lot of people, it never occurred to them that they had a choice about how they're touched. Never occurred to them. And you'd ask someone, for example, how do you want me to touch you for a few minutes right now? And they'd say, I don't know, nobody ever asked me that, which is probably true. Or I don't know, I just, whatever you want to do is okay with me. Well, that might be true, but it's not the question. Or, well, you could rub my shoulders, I guess. Well, I could, but that's not the question. We're going for what you want, what sounds wonderful to you. Oh, like I never thought of that. And it's I'm kind of,
It's like the ice cream truck just drove up.
yes, yeah, like, oh my gosh, you mean I can choose? And people often didn't know how to even notice what it is that they wanted. And it's completely understandable. And I've been in the same place many times because of those childhood experiences where we're touched against our will. And we might have learned that we do have a choice, and we might not have learned that we ever have a choice. So kind of it's about learning how to notice that you have a choice and how to exercise the skills of making the choice and communicating your choice. So to play the 3-minute game, you'll just, all of this stuff will come up just in the structure of the game.
Right.
You'll just notice things that you go, holy shit, I never knew that I thought that.
Right.
Or, oh my gosh, that was easy. Or, oh my God, that was hard.
Mm-hmm.
And it just all comes up because it's just in the structure of the game.
Yeah, and it's like the invitation to know yourself, know your body in a way that's deeper than you had previously. And it makes me wonder, like, these things come up. Are there sometimes things, like memories and things that come up as well that are really hard, I would think.
Oh, absolutely.
Yeah.
Absolutely. Which is why I recommend that you start with 3 minutes, not an hour, start with 3 minutes, because then even if you kind of freeze there, the 3-minute timer will go off, and then you can reset and start over.
Right.
And I think it's important. I did want to say this about trauma. What makes a big part of what makes something traumatic is that we don't have a choice about it. If we had a choice about it, it wouldn't be trauma. So the experience of not having a choice about it is a big part of what makes something problematic. And so now, fast forward, and now we're here playing the 3-minute game with our buddy or our therapist or whoever. And now we do have a choice. that's what changes things. Noticing, oh my gosh, I have a choice here. And guess what? Tears are going to come up because of all the times that we didn't have a choice. And yeah, so it, it's just another reminder to be gentle with yourself.
Yeah.
The point is not to, okay, well, I'm going to make sure that I'm okay with this back rub and I'm going to push myself through it and just make myself be okay with this back rub. Fuck that. Just forget it.
Yeah.
Notice instead, or it takes some courage to slow down. Absolutely. Because when you slow down, you notice things that you didn't notice and your feelings come up. So if you don't want to have feelings, then just rush through it and, get it over with. But, when you slow down and you notice, oh, wait a minute, what actually do I want? Do I want that? No. Maybe this? Nah. Well, I should want this, but I don't actually want it. So, or this is the thing I'm supposed to want because that's what the video said I should try. Forget that. What is it that actually sounds really wonderful? Oh, will you hold my feet for 3 minutes? Then go for that. And then the experience of noticing that you have a choice and the experience of making the choice builds it just counters all those years of going along with stuff that you didn't want. And it's a gradual, gentle process.
Yeah. Built into the 3 minutes.
Mm-hmm.
And it's a
Yeah.
practice, like you said.
It's a practice.
And
Yeah.
it takes some practicing. And
Yeah.
I'm guessing that, after a while, the 3 minutes might become
Yes.
5 minutes,
Mm-hmm. 10
etc.
minutes, 20 minutes, an hour, a day, yeah.
There you go. Yeah.
But it really helps to start with short turns and helps to start with not sexy areas. Start clothed, start not in the bedroom, because for many people, as a culture, we kind of conflate touch and sex. And so we think if touch is happening, then sex is nearby somewhere,
Mhm.
And so it's important to have experiences of touch that are not about sex because they're two very different things. You can have touch without sex. You can also have sex without touch. They're just different. So when we can have experiences of touch that are not about sex, it feeds us in a different way. And yeah, so I recommend that you start with touch that isn't about sex. It's much easier.
Oh, I'm feeling all filled up just by our conversation so far. And I love how slow, in a way, we're just talking about this. Like it's almost,
Mhm.
it feels kind of like what would happen if we were actually engaged in
Mhm.
practice in a way, because we're
Mhm.
kind of going slow and
Yeah.
there's just time for
Yeah.
it all. It's really beautiful.
Yeah.
Yeah.
Yeah. Thank
You
you.
want to talk a little about where generosity fits in here?
Yeah, that's a great question. It seems that we all kind of want to be generous or wish that we could be more generous or think that we should be more generous. And often that means that we think we should be okay with stuff that we don't like, or generous with our body, or our partner wants to do XYZ and we think, well, I should be okay with that. Why aren't I okay with that?
Yes.
And I want to say, first of all, that you don't need a reason to not be okay with something. Like, it just that doesn't work for you right now, or maybe ever.
Mhm.
But but it's a question that often comes up in like, well, my partner wants to do X, Y, Z, and how can I be okay with it? And I think it's a great question, but I think it's kind of the wrong question. The question is, well, if that is not a gift that you can give with a full heart, there's something else that you can give with a full heart. And what is that something else? Maybe your partner wants to spank you, and that's not a hell yes for you. That's a, well, I could really get it. Then what is something else? Well, you could feel my butt, or you could explore my legs, or you could spank me lightly but not hard, or you could spank me once and then stop and let me see how I am, or you could, rub my back, or that there's something that you can give with a full heart, probably. Or maybe not. It may be that, what, I am not ready to play this today. And
Yeah, like maybe even hearing that you want to spank me makes me not want to hang out here for a while.
yeah, it might be like, holy shit, let me just calm down a little bit.
Yeah.
Yeah. But I think what's the question to ask, or what often happens for people is ask, well, I want to be more generous, so how can I stretch what I'm comfortable with, what I'm comfortable giving? And the answer is kind of counterintuitive, because it's not, the point is not to stretch what you're comfortable with. The point is to be very, very mindful of your inner no. Sorry, the airplane going over.
Didn't hear it.
Okay. To be very mindful of your inner no. Because when I can trust my own ability to say no, something magic happens, and that is that I relax.
Yes.
There's a kind of, yeah. There's a
I write about this in my book, and I call it Sacred No.
Yes. Yeah. Yeah.
And how important it is.
Yeah. Yeah.
To be able to say no before you can say yes.
Yes. Yeah, absolutely. And being able to say no is what allows you to set a limit of like, okay, yeah, you can play with my legs from the knee down, or from the thigh down, or from the front, or from the back, or whatever, so that when you set your limit and speak it and have the skill to defend it if necessary, because sometimes people forget, then you become trustworthy
of yourself,
and then you can trust yourself. In fact, if you are trustworthy, you will automatically trust yourself. Trusting yourself is not wise if you're not trustworthy. So become trustworthy, and then you'll automatically trust yourself, and then you relax, because you're not worried about what's going to happen next, because I can say no to what happens next. I'm not worried about it. And then what happens automatically is that you become generous inside this circle of your no, and of your limits. And then inside that, oh, that's easy. I can give this, I can give this, I can give this. Yeah, with joy. And those other things out there, I ain't giving those.
They're not in the circle of no.
They're not in the circle. Yeah. Yeah.
I love how you put all of that just now. It's so gentle, and it's so clear, and and it takes practice again.
Oh yes, it takes practice. Absolutely.
It's not like
and yeah, start slow and gentle.
I got my no now. I'm all good.
Yeah.
To go.
Right. Yeah. No, it takes some practice. Yeah.
It takes a commitment, really.
Yes, it does. And it takes some experiences of having it respected. Because you may get better at saying no, and then somebody walks right over it, and that doesn't help. But that's one thing about the 3-minute game. It's short. It's only 3 minutes.
We can
It may
try.
take you. It may take you 15 or 20 minutes to get to your question, and then you only have 3 minutes. But um, but you gradually you have many opportunities to practice asking and saying yes or no. Yeah. Yeah.
So, it doesn't feel like it, but we've actually been talking for a while.
That's true.
I know.
You had something else, I think, on your list.
Well, I'm just looking at it to see if there's anything that we really must cover before we start closing. I recognize that this work has developed into trainings for somatic therapists, massage therapists, sexuality educators, medical and health workers, etc. Do you want to say anything about?
Yeah, well, I think I want to say, I want to bring it back to healing sexual trauma, which is the theme of and what does this all have to do with healing sexual trauma? And I would say that it's a partnered practice. It's not a solo practice, and so it requires having a partner or practice buddy or therapist or something to play it with. And then I think the biggest way that it contributes to healing of any kind of trauma is the practice of noticing you have a choice and making the choice. Noticing you have a choice and making a choice. And the touch, if it happens, is kind of a bonus. That really, where the work here is the opportunity to notice you have a choice and to practice making the choice. And then to find out that you enjoy it, it's like, oh, wow, cool. So I think that's where it fits into the trauma picture. It's not a trauma therapy, but it is very effective in supporting you in learning those things, um, and it will challenge everything you got. Stuff will come up because it's so gentle that that's what makes stuff come up. Yeah, yeah,
Yeah, and little by little,
yeah,
we own our bodies again.
yeah, yeah. And you have some enjoyable experiences.
What?
Who knew? Who knew that was an option? It's experiences that actually are enjoyable instead of that you think are supposed to be enjoyable.
Oh, I have to touch my heart again to that, Betty, because it's
Yeah.
such an important distinction and it's
Yeah.
such important work. And I'm so glad that you are doing it, that you have
Thank
done
you.
it, that you're teaching
Thank you.
people to do it. It's
Thank
so,
you.
so important.
Thank you.
I think we need to wrap
So the
up.
classes,
Okay,
the schoolofconsent.org is where you find the classes, and some are for practitioners and some are for regular people, and just go there.
Go there. People go there.
Go there.
Run, don't walk. So with that said, Dr. Betty Martin, I don't know how to thank you enough for sharing yourself with us.
You are very welcome. Thanks for putting this summit together.
Mhm.
Yeah.
Here we go.